Picture this. Under bright hospital lights, a 9-month-old baby's DNA was altered. We're asking, will gene editing reshape medicine as we know it?
Today's date is May 16th, 2025. Let's set the stage. A baby called KJ, just 9 months old, was born with an extremely rare and deadly liver disorder, carbamoyl phosphate synthetase 1 deficiency. This means his liver can't clear ammonia from his blood. Without intervention, it's almost always fatal, isn't it?
That's right. Traditionally, the only real option has been a liver transplant, which comes with serious risks and depends on finding a donor. Doctors at the Children's Hospital of Philadelphia had to choose: wait for a transplant or try something never attempted before, a personalized CRISPR gene editing therapy.
How fast did all of this happen? Was it something planned over years, or?
That's actually what's so striking. From the moment of diagnosis to the start of treatment, only 6 months passed. The team developed a therapy unique to KJ's specific mutation, using CRISPR to fix the DNA error in his liver cells. They delivered it through 3 infusions, right into his bloodstream, targeting the liver.
So, there was no surgery involved? They just infused the gene editing tools directly? That sounds risky. Weren't they worried about things going wrong? Like off-target edits?
That was a major concern. They started with a low dose, watched KJ closely, then went higher once they saw he could handle it. The therapy was built to limit off-target changes, but like with any new approach, there's still uncertainty about long-term effects. This is a breakthrough for sure, but it's also a first test.
And after the treatment? Did they see any changes in KJ right away?
Within a few weeks, his ammonia levels dropped. He started to hit developmental milestones that would have been out of reach before. It's too soon to call it a cure, but his progress is ahead of what doctors would expect for someone with severe CPS1 deficiency.
That's a major step for one child. But are we talking about a model that could help others too? If the process, from diagnosis to custom treatment in 6 months, could work for other rare diseases, that would be huge.
That's the idea. The approach they used for KJ can, in principle, be adapted. If you can sequence a patient's DNA, spot the mutation, and design a CRISPR fix, you could target other rare genetic diseases. But there are significant hurdles.
You mean cost, complexity, things like that? Because if every therapy is personalized, scaling up seems tough, especially outside of leading hospitals.
Yes, exactly. The amount of resources and expertise required is huge. For now, access is really limited. Most hospitals can't offer this, and it's even further out of reach in low and middle-income countries. So, making this widely available is a real challenge.
There's also the ethical side. Even if you're not editing reproductive cells, changing someone's DNA is a serious step. How do we weigh the hope against the risks? And who gets to decide which conditions are worth editing?
KJ's case really highlights the importance of informed consent. His parents had to compare the risks of an experimental treatment to those of a transplant. But going forward, broader questions need to be discussed, like who has access, who pays, and what support is in place if problems emerge years later.
This calls for more than just medical guidelines. We're talking about a conversation that involves the whole of society. Are we actually prepared for that?
That conversation is already beginning. KJ's experience isn't only a medical milestone, it's a preview of what personalized medicine might look like. But as we move forward, we'll need clear ethical standards and genuine discussions about fairness and access.
So we're heading toward a future where rare, deadly diseases might be treatable at the genetic level, but only if we solve the practical and ethical puzzles first.
That's it. The science is advancing quickly, but if we don't keep up on the ethical and social side, these advances could actually make disparities worse.
In short, a baby's life was changed by rewriting his DNA. The science is real, but the questions are immediate. So, what's next?
Thanks for listening as we explored KJ's story and what gene editing could mean for medicine's future.
Keep asking questions, keep exploring, and thank you for joining us.